you'll understand why your body's electrical system holds the key to profound healing and why I am so passionate about it. Hey everyone, Dr. Bloem here, and if you're like most people, you've probably tried a dozen different things to tackle chronic pain, brain fog, or that sneaky feeling that your body just isn't quite right. Well, prepare to have your world rocked in the best possible way, I promise, because today we're diving into something truly revolutionary: neural therapy. Now, some of you might be thinking, neural what? And that's perfectly okay. For the newbies among us, this is your foundational guide to understanding how this incredible therapy works. For those already familiar, you're in for some exciting new insights because I've just returned from the Advanced Neural Therapy workshop last weekend, building on the skills I gained from the foundational workshop in June 2025. I'm absolutely buzzing with new knowledge, and yes, probably a little bit of procaine too. You'll understand why in a moment. Stick around, because by the end of this, you'll understand why your body's electrical system holds the key to profound healing and why I am so passionate about it. So what exactly is neural therapy? At its heart, the art and science of using a simple, safe local anesthetic, procaine, to reset your nervous system back to its healthy state. Think of your body like a super sophisticated electrical grid. Every cell, every organ, every tissue communicates through electrical signals, operating what we call your autonomic nervous system, ANS. Normally, your ANS has this beautiful ability to flow between sympathetic and parasympathetic branches without interference. We call this open regulation. This is your body's natural state of health, easily switching between fight or flight and rest, digest, and heal. But sometimes things get stuck. These stuck areas are called interference fields. Imagine a short circuit in your home's wiring. That faulty wire isn't just a problem locally. It can dim lights, trip breakers, or even cause power outages throughout the whole house. In your body, interference fields are areas where past traumas, infections, or even old scars create electrical disturbances that disrupt your body's natural communication pathways. These blockages can wreak havoc not just locally, but often cause problems in completely different, distant parts of your body. The story of neural therapy actually begins with a bit of a happy accident in 1940, thanks to Dr. Ferdinand Haneke. He discovered the concept of the interference field when he injected a patient's osteomyelitis scar, and almost immediately a long-standing, unrelated frozen shoulder cleared up. A phenomenon we now call the Haneke phenomenon, or lightning reaction. Talk about a game changer. The star player in this therapy is procaine, a medicine first synthesized in 1905 as a replacement to addictive cocaine. But procaine is so much more than just a numbing agent. It actively stabilizes nerve membranes, promotes healthy circulation, and uniquely possesses anti-aging and antidepressant effects. In fact, the famous Dr. Anna Aslan in Romania used procaine mixed with magnesium and B vitamins in her anti-aging clinic, treating everyone from Winston Churchill to Marilyn Monroe. Procaine is easily metabolized by the body into harmless components that enhance circulation and even stimulate vascular growth. This means gentle yet powerful healing without the harsh side effects of many other medications. So how does this tiny injection make such a big difference? When your cells are constantly stuck in an interference field, they become depolarized, like a battery that's run out of juice. Your brain is constantly dedicating energy to these stuck areas, leading to fatigue and chronic symptoms elsewhere. Procaine literally recharges these depleted tissues. It helps restore the cell's electrical potential, allowing it to communicate properly again. Imagine that short circuit being fixed, and suddenly all the lights come back on, brighter than before. This can lead to dramatic and often immediate relief from long-standing pain and other chronic conditions. Dr. Jeff Harris, my neural therapy instructor, related a story involving an old vaccination scar. He injected it and his head exploded. Not literally, thankfully, but energetically, releasing years of trapped energy that had been affecting his brain function since second grade. It's wild, but that's the power of these electrical resets. Now for the really exciting part. Having just completed my advanced neurotherapy workshop last weekend, following my foundational training, I'm equipped with even more precision and understanding of how to address complex conditions. We dove deep into targeting specific ganglia, clusters of nerve cell bodies outside the brain that act like mini brains, governing specific regions and functions of your body. Here's a glimpse into some of the powerful treatments and their benefits. Whiplash and neck pain. For acute whiplash, a targeted injection to the tonsil area, which is near the superior cervical ganglion, within 24 hours can make symptoms vanish in almost 99% of cases. Even chronic neck issues can see significant relief. Headaches, migraines, and brain fog. We learn techniques like the crown of thorns, injections around the head, and treating the sphenopalatine ganglion. These treatments can dramatically improve brain circulation and clarity. Dr. Harris even shared that he uses procaine drips in his own nose for allergies and that it can help with eye conditions too. PTSD and chronic stress. By directly addressing overactive stress centers like the stellate ganglion and vagus ganglion, neural therapy helps shift your body out of constant fight or flight and into a state of rest, digest, and heal. Patients often experience significant reductions in anxiety and a profound nervous system reset. Digestive harmony. Your gut has its own brain called the celiac ganglion. By treating this and even old belly button scars, yes, your belly button is your first scar and can be an interference field, we can restore proper digestion, absorption, and detoxification. Pelvic and reproductive health. The pelvic trigger point injection, also known as the inferior hypogastric ganglion, is incredibly effective for chronic pelvic pain, menstrual issues, pelvic infections, and even supports fertility. It can even facilitate significant emotional release linked to past traumas in that area. Respiratory issues. For conditions like asthma and bronchitis, the infraspinatus respiratory response, IRR technique, can lead to significant improvement, even complete cessation of symptoms in chronic cases. Many patients feel their lungs more open after treatment. Autoimmune conditions. Neural therapy can even support complex autoimmune diseases by utilizing autosanguinous therapy, using a small amount of your own blood mixed with procaine to help reset immune dysregulation and restore neural regulation. The key takeaway from my advanced training is that we're learning to listen to the language of the autonomic ganglia. Through careful history taking and precise techniques like autonomic response testing, ART, a specialized form of muscle testing, we can identify these interference fields and address the root causes of dysfunction. So what is it like to actually get neural therapy? First and foremost, open communication is paramount. I'll explain everything, make sure you feel informed and comfortable. I prefer to use words like touch or discomfort rather than prick or pain. Most patients find it far less uncomfortable than they anticipate, often confirming it doesn't hurt as much as a typical dental injection. You'll likely experience immediate numbness and sometimes a bruise might pop up. It happens and it's normal. But the cool part, you might experience an immediate change in your symptoms, that lightning reaction where something that bothered you for years just poof, vanishes. One common and often cherished side effect is the nap effect. After a treatment, your body might decide it's time for a system update. You might feel incredibly tired, so tired you might need to pull over for a quick 10 to 15 minute nap. It's your nervous system resetting, and patients often report it leads to the best night's sleep ever, even chronic insomniacs. So don't fight the nap. Embrace the reset. Sometimes old scars hold not just physical tension, but also deep emotional energy. During a treatment, an emotional release can happen, sometimes with tears or a strong expression of emotion. It's a powerful part of the healing process, allowing suppressed feelings to surface and be released, leading to profound psychological shifts and physical relief. Finally, safety is always our top priority. We use strict protocols, specialized needles, and precise injection techniques to ensure the highest level of care. Neurotherapy isn't just about treating symptoms. It's about addressing the fundamental electrical imbalances that prevent your body from healing itself. It's a holistic, gentle, and incredibly powerful way to unlock your innate capacity for health and vitality. I'm so excited to bring these advanced techniques and insights to my practice, combining the foundational knowledge with these new skills to offer you an even deeper level of healing. If you've been searching for answers, if you're tired of just managing symptoms, then it might be time for your body's electrical system to get a proper reset. If this video piqued your interest, please like it, subscribe to my channel, and hit that notification bell so you don't miss out on future insights into optimizing your health. I'd also love to hear your thoughts and questions. Leave a comment below. Have you heard of neurotherapy before? What chronic conditions are you curious about? Let's keep the conversation going.